Good evening, everyone. My name is Jessica. I am the health educator for West Milford Health Department, and I'm also a health educator at Chilton Medical Center. I'd like to welcome you this evening to our Lyme and tick-borne diseases panel. We will have 3 panelists this evening. Each one of them will give a brief presentation on their knowledge regarding Lyme and tick diseases. And at the end of the panel, after each one of our panelists has presented, they will have a question and answer session, so please save your questions to the very end. We will have a question and answer session after each one of our panelists gives a presentation. I'd like to introduce our first panelist, Dr. Aslam.
My presentation is focused mostly on prevention of Lyme disease. So this was first recognized in 1977 as Lyme arthritis during a cluster of children in Connecticut who were thought that they had juvenile rheumatoid arthritis. The etiology was discovered to be a spirochete Borrelia burgdorferi in 1980s. And this was established as a reportable disease in 1991. And the incidence and the geographical distribution of the cases have steadily increased since then. In 2014, Lyme disease was the 5th most common reported disease in the US. Ixodes scapularis is also known as the black-legged tick or dare tick, which is the sole vector for Borrelia burgdorferi in the hyperendemic regions of the eastern US. Other Ixodes species are vectors for Lyme disease in certain other regions. So the peak incidence would be during the summer months of June, July, and August, like right at this time. In the eastern US, the primary reservoir of the host for Borrelia burgdorferi is the white-footed mouse, the Paromycus leucopus, or other small rodents. So I just wanted to, so this is how the ticks look. This is a female Ixodes tick, and this is actually very small, 3 millimeter. In length. And the reason why I put a picture here is like I was working in the hospital and they found a tick on a patient in the hospital. But it was a pretty big tick. So that wasn't the one that transmits Lyme disease. So it's just an idea to see that they are really small.
Would you like a live specimen?
Oh, you have one? I'll take a look later. So this is the ones that cause Lyme disease. This one, which has like a white dot in the center, this is a lone star tick. It causes other stuff but not Lyme disease. And this is the dog tick. So you see like these are relatively smaller as compared to the other ticks. So they have 3 stages in their life: the larva, the nymph, and the adult. And Lyme disease is most commonly transmitted by the nymphal ticks. And the individuals that are at highest risk are those which are living in the endemic region or have occupational or recreational exposure to ticks. Like, for example, if you're a landscaper in the forestry department, or if you are working as a telephone line worker. If you like to go hunting, camping, hiking, gardening, even children who like to play in the woods are at risk in these areas. So this is like, I'm just gonna, my only thing was here was like, because when you talk about the environmental exposures, so it's just a small thing to tell you that these eggs, they are usually found on the leaves and on the vegetations, and that's why they usually say to clean up that area. So they grow over there, and then when they become larvae, this is the white-footed mouse and the birds and other rodents that they feed on. And then when they become adults, they solely feed on the dare. So adult ticks will feed on the dare, but the nymph will feed on rodents, other small animals, birds. So if you get a tick bite, well, Borrelia burgdorferi is not usually transmitted within the first 48 to 72 hours of tick attachment. But the likelihood of transmission is increased if the tick is engorged or has been attached for at least 72 hours. And if you find a tick, what do? You either remove them by tweezers or by protected fingers, pulling straight up with even pressure. So you don't want to use your bare hands, because if you squeeze it and it's infected, there's a risk that you may get the Lyme disease. So this is just another slide showing This is the female. So this is the actual size, and once it feeds on you for 72 hours, this is how big it gets. And this is the dog tick. But still you see like there is a difference in the way they look. Okay, so how would you protect yourself from Lyme disease? So the first thing to come would be the personal protection. So once you're outdoors, you check yourself for ticks. Bathing after outdoor activities where ticks are abundant. If you take a shower within the 2 hours of coming home, you know, it won't remove the ticks that are already latched on or are sucking the blood, but if there are any ticks on the clothes, at least that you can get rid of. And there were studies in Connecticut where they placed the clothes in a dryer for a short time after outdoor activities. So if your clothes are dry, it takes like 5 minutes for the ticks to die, but if your clothes are wet, it takes longer. They say if you put your clothes in the dryer when you come home for an hour, everything dies. So, I mean, that's another thing. If you're like working mostly outdoors, rather than washing them, just put them in the dryer for, you know, one turn before you wash them. Wearing protective clothing. If you are going out for barbecues in an area where you know that ticks are common, probably a good idea to wear pants and full sleeve shirts. Using DEET on the skin, and for clothing you can use permethrin. Do not use that on your skin, and avoiding areas where ticks are abundant. So ticks that are feeding are usually firmly attached to the skin, and once they suck on you and they get engorged, like the picture I showed you, they just fall off, and they are a little bit larger and globular in shape. And if you find an engorged tick on your body or at home, it's a probably good idea to call your doctor, because the chances of disease transmission are probably higher. So antimicrobial prophylaxis, if within the first 72 hours of tick removal, you could give a single dose of doxycycline. So, you know what, this is not working. Slide is not coming down, but for people who get the antimicrobial prophylaxis, there are certain criteria. The tick has to be one of those dare ticks. The other thing is that it has to be attached for at least 36 hours, and you should be within the first 72 hours of tick attachment, because if it's after 72 hours, then we would just treat you with doxycycline and not give you just one single dose. And you know, if doxycycline is not contraindicated, like in children under 8 years, you don't give doxycycline. You don't give doxycycline to pregnant women or lactating females. These are just some, in case if you see a rash, what would the rash look like? So it is something like this, like a bullseye-like lesion, but it doesn't have to be like a textbook kind. You could have something like that, or even like with some petechia in the middle. So just some pictures to see if you get a rash, you know, what to look for. So there was a vaccine that was approved in 1998 for Lyme disease, but there was a concern that it will worsen autoimmune arthritis or Lyme disease related arthritis, so it was discontinued after poor sales. So they are working on it, but there's no such like vaccine out there that you could get for Lyme disease.
Thank you for having me come over. I practice in Mount Kisco. I've been there and practiced for 30 years, and my son was, went to auto school over here in Mawa, which is, I guess, halfway here, so some of this area was pretty familiar. So given that's the case, I wanted to just get right down to business. Since I'm in practice, it always seems like there's always a few little nuances that come up with ticks, because somehow, even though the ticks are talked about in the fall, there's adult ticks. They're when you don't have a dog tick right next to it, it's very hard to remember that an adult is pretty good size. The nymphs are small, so as adults, when people look at them, they're surprised that they certainly are pretty easy to see. And And also the adult ones, even though they like deer, they'll take any meal they can get. So, you know, I have patients that come in that found that that deer tick, the adult one, took me on. So then there's always more than one thing in a tick. And so when there's more than one thing in a tick, then sometimes you get people who are sick and the disease got transmitted and they're absolutely sure that that tick wasn't on very long. That tick looked pretty flat. But if you got a big old EM rash, or you got you're sick after a tick, you better take that tick seriously. The other thing is that doctors are always fighting over ticks and how long to treat for a tick bite. And so that 2-doxycycline pill is an approved protocol. But it's just as a doctor, you run into these nuances of it prevents 80% of ticks. It prevents 80% of rashes. But they didn't study whether it prevents more complicated Lyme, like chronic Lyme or neurologic Lyme or late Lyme. And so the 2-doxycycline pills, when you get a tick bite, you could say, well, that it's approved, but you know, since I'm always in practice, and sometimes there's always people who get Lyme anyway after the 2-doxycycline pills, I always get nervous about 2 pills. I tend to either just do nothing and just watch very carefully, or I have them take 3 weeks of treatment. But that's because I'm departing from just your standard, ordinary 2-doxycycline pills. So I'm here, I was asked to present on more on the co-infections instead of just on Lyme. Is there a presentation right after me more on the Lyme itself? Yes. Okay. So what I'd like to do is say, listen, is that these ticks, these are ticks that were discovered in amber. That's that stuff that falls off the sap of an ancient tree. So they found it 15 million years ago that some ticks happened to get caught up in amber, and someone had it on their shelf for a long time. And he said, I know it, why don't I look and see what's in that amber? And he found 4 ticks, describe it in Nature magazine, and the ticks were very similar to what we have today. And they found a Borrelia, which is a certain type of bacteria in the tick, that was very similar to what we had today, but he was reluctant to break it open and look exactly at everything that was in it, because then you permanently alter the bacteria in the tick. They did find this guy who they thought was in the Austria mountains as a hiker, but it turned out that, or a climber, it turned out he had been up there for 5,300 years, frozen, before Christ, and at that particular point he had an arrow in his chest, but when they took him down from the mountain, looked at him, they found he had one disease, which was Lyme disease. And you know, they looked at it and it was very similar, highly similar to the very types of bacteria we have today in Lyme. They also found H. pylori, which is this bacteria that causes stomach ulcers. So, and his stomach was full of H. pylori, but also he must have been strong enough that his last meal was a bunch of elk or deer meat or something like that. So, but wanted to say that in a tick, this was 1998, years ago. Not only was there Lyme in these ticks in New Jersey in this one study, but there was Ehrlichia. Ehrlichia is a certain type of bacteria that's atypical bacteria that can cause one to die, but it's very rare that you would die. It's like 2 deaths a year or something like that. Most of the time it can lead to like a high fever, you know, low neutrophil, which is low white count, some liver function test. They've also found Babesia, which is a parasite in the ticks. And then they found Lyme and Ehrlichia in ticks. Some of them have more than one combination. And every time they look, a new organism, they find those ticks are biting mice, and they're picking up all kinds of bacteria than Lyme itself. And so when you get a bite, and you're thinking, should I take 2-doxycycline pill? Is that necessarily what to do with those ticks? So the U.S. government said instead of just doing Lyme maps why don't they take a type of Ehrlichia called anaplasmosis. Now, everybody who has a dog in this room knows that they changed one type of Ehrlichia from calling it Ehrlichia to calling it anaplasmosis. So it's still we used to call it Ehrlichia. So this map, they didn't look at every state, but if you look at this map, you'll see that they looked at the red states. And sure enough, pretty much wherever you look, like in New York, you'd find plenty of anaplasmosis in those ticks. So we want to make sure we don't forget to treat for anaplasmosis. They haven't looked at all of them. The other thing they found is that what we thought was some babesia, which is a parasite in the tick that comes from the mice, it turns out that by these leading researchers, including Krauss. Krauss was kind of the father of babesia. He's the one that said, hey, I found this parasite, I'm going to spend my entire career with this parasite. And for some reason, when he started describing it, he found that it makes Lyme much more difficult to treat. It takes different treatment. You have to treat the parasite. He found that by now, 40% of people with Lyme in the Northeast have babesia. So 4 out of 10 people. So if I have somebody come in my office, there's 4 out of 10 chance that they also have babesia. They found that babesia kicked the anaplasmosis, which is at HGA over here. So 13% had Lyme with babesia. 2/3 of the babesia experience Lyme, and 1/3 experience. So no matter which way you look at it, it could be 2 or 3 things at once. And then if you just look at babesia itself, some of them don't have Lyme, they just have anaplasmosis. So there's this other type of Borrelia. Borrelia is a type of bacteria that's in ticks. So we call it Borrelia burgdorferi because Dr. Burgdorfer discovered the type of bacteria that's in a tick. Then they discovered this thing in a tick that they thought was just in the tick, just hanging out. So in Japan, they said, no, that tick, that Borrelia in a tick means something. They get sick. They get quite sick. So they called it Borrelia Miyamoto. They got the luxury of using a Japanese name for something that's been around in America. So there's a huge amount of Borrelia Miyamoto in the Northeast. There was a recent paper at a conference that there's a huge amount in California. So not only do they have Borrelia burgdorferi, they have that type. And it's spiral like Lyme. They call it a relapsing tick-borne, it's a relapsing fever tick. Except when you look at the literature, only about 2% had a relapsing fever. They just had a fever. So they figure, well, it is a relapsing fever. It acts like a relapsing fever, except it doesn't have a relapsing fever. But maybe it's because the doctors treat it. So I'm not as sure it says relapsing the fever. It's identified in 1995 in Japan. The same ticks, the rashes aren't that common. The PCR tests aren't that good. In fact, the tests aren't that good. They think doxycycline works, but since you can't measure who has it very easily, it's hard to know who gets better. Borrelia Mayo. So in Mayo Clinic, they discovered another type of Borrelia that's up in the Mayo Clinic, but it's not too common. There's 6 out of 9,000 specimens, which is a lot of work. 0 in the rest of the U.S., and there was a study that came out this week that said one area of Europe doesn't have that. So it's not a very common bacteria. Same ticks, same kind of serological response. They think doxycycline, amoxicillin, this is the IV, or this Ceftin works, but with only a few cases, there's not much known about it. So complications of tick-borne illness is that in 1990, they discovered that this is the whole group of people with memory, concentration. What it is that the immune system gets busy, adrenaline gets going, they're so fatigued, so exhausted, they're wired, they can't sleep, they can't concentrate, every mood you can think of. They're lightheaded, they're dizzy, they're pressure in their head, and numbness in their hands and feet, and pain. But yet nothing on the physical exam typically. And neurocognitive, they found a lot of people have memory and concentration, so there's studies on that, studies on people who seem sick after Lyme. So instead of treating them, they just say it's post-treatment. Neuropsych, there's a lot of people who happen to have dementia, or dementia-like rather, schizophrenic-like, manic depressive, ADHD type. There's a group called post-Lyme, which means that if you get 3 weeks of treatment and you're still sick, they'll say, oh, well, we'll study you and we'll follow you, don't need any more treatment. And they found those people sometimes are sick, a third of them are sick at 6 months with severe fatigue, severe pain. Some of them are sick for 10 years. And it might even be more than that, because most people who get this eventually drop out of the study. 60% drop out of the study saying, I don't want to be in a study where I'm still sick. And sensory neuropathy means that numbness in their hands and feet. POTS is one where you get lightheaded, you faint when you stand up, or feel like you're going to faint when you stand up. The autonomic nervous system, which is the adrenaline, is not cooperating. Some of them seem to have a pandas type, which means they get fits, Tourette's, and OCD, and all kinds of problems in kids. And they thought it was strep, but they changed the name to PANS because they think that maybe the ticks do the same thing, and that maybe the two cross over a bit. So there's so much research on why can a tick cause so much havoc. So at Westchester Medical Center, they found that down here that there's some clones that are easy and some that are tough. Maybe there's biofilm. Maybe that's this tissue where the tick, that the spirochete hides. Maybe they turn into cysts. These are still rudimentary. We never know what's the right mechanism. Maybe they're white spots in the brain. Maybe they're hiding in the brain. Maybe they're these genes keep expressing different DNA over and over and over again. And persisters, that some of them might be getting killed, but it's very hard to get rid of them because they persist. It's important to get to know what's going on in the tick, but in my practice, it's hard to find one antibiotic that works for everybody. So that's why I might use doxycycline, because it's great, it fights infection, but it doesn't work for Babesia. If I were to treat the Bartonella and focus only on this, that research is kind of flimsy because it's also in a cat, on the cat's catch fever, so they're not ever sure if the Bartonella is from cat or something else. So that's why, but if you pick some of these more eccentric ones like over here, rifampin and Bactrim, that's not going to necessarily treat some of these things. So it's hard to find one antibiotic that you can go to a desert island and say, I'm going to stock all my doxycycline, go to a desert island, take that, and that's going to take care of everything that's from my tick. First of all, you get burnt up from the sunburn from a tick bite, unless you take suntan lotion along. There are 3 weeks of doxycycline is talked about for kids over 9, and moxicillin below that. So the IDSA says 3 weeks is enough, and if you have arthritis, maybe go a little longer, like another month. But I'm a member of a different organization called ILADS, ILADS, International Lyme and Associated Diseases Society, that says, well, that works, except it doesn't work for everybody, that sometimes 3 weeks isn't enough. So the NIH, tried a couple studies, but they enrolled people that were sick for 5 to 10 years, and they were hard to treat. So we're kind of at a stalemate. But what ILADS talks about is that there are things that aren't studied in double-blind, randomized, placebo-controlled studies, that there's other pills, there's intravenous, there's longer duration of antibiotics than 3 weeks. There you can go higher doses, 2 antibiotics at once. That's, you might want to treat for Babesia and Lyme. And they have shown that people who have Babesia and Lyme are more severe, more difficult to treat, harder to treat, and you have to use combination therapy. Maybe treat a second time, maybe treat Babesia. Everybody should avoid alcohol and sugar because it gets the immune system going. They should exercise if they can. We do a lot of counseling because if you're sick and that crappy, a pill isn't always going to get you settled and get you focused. And then many people have severe pain, sleep, and fatigue, and so we try to help manage those things. So there's a lot of doctors who, I'm one of them, that treat beyond the IDSA guidelines and treat beyond 3 weeks. So this one study of insurances in the Northeast found that they found that there's 16 people who actually treated a lot of the cases, 20% of the cases. So reading through the line, I think I'm one of those 20, one of these 16. It's just that there are 488 total doctors. That means 80% of the patients who are being treated by providers for longer than 5 weeks are your neighborhood doctors. There's so many doctors who are treating beyond 3 weeks, but they're trying to do what they can for their patients. This just shows you that their prescribing pattern, when you look at the number of antibiotics, number of refills, longest drugs, multiple drugs, that there are a lot of doctors doing more of those things. It just shows you that there's still uncertainty among doctors how long to treat. So my last couple slides, this was just shows you that in practice it can be a little bit complicated. So this was a study in 2015 where this one young man had gotten treated for Lyme with doxycycline, and then he's developed a new onset panic, depression, suicidal thoughts, somatic symptoms. But because he had already been treated for Lyme, they decided that maybe they should do cognitive behavior therapy. It means talk about it, do some behavioral changes, do some counseling. But when I went through the articles, this was published in this one case reports, is that the patient had a positive Babesia test, but there's no evidence that they would treat the Babesia. So since it's a 40% chance of Babesia, you know, it would have been nice to at least see if Babesia would have helped rather than just cognitive behavioral therapy. And the other is that they treated with oral doxycycline, but they didn't treat with IV. So I don't use intravenous antibiotics except for if I try to treat Babesia first. I try the dietary things second. I try counseling third. But maybe this case would have been benefited from intravenous because that goes into the brain. And in this one, there's powassan in a tick, that's in the news lately. It's a virus. So there's no exact treatment for it, like a traditional antibiotic, because everybody knows you can't treat a virus with an antibiotic. So 2%, 3% of ticks have this in it. I don't see it in my practice because if they have encephalitis, they shouldn't be coming to see me and set up an appointment. They should go to the ER, and because it happens pretty quickly. So there was 2 deaths, like maybe 2 or 3 deaths a year that they think is powassan. Now, what this article was 2 years ago, where this 17-year-old, getting ready for college, went to Brown, but on the way to Brown, they have a camp, a summer camp, where they get together and do things. Came home from camp in August, was feeling kind of crappy, and they were convinced that it was this virus called powassan. This was in the up in the upper Hudson Valley, Poughkeepsie area. So the problem was that when they were trying so hard because they were pretty sure he was pretty sick, so he died in the backyard. And they found him in a kind of an arrest situation. So when he went to autopsy, that was published in this journal, and they found there was not one lick of evidence of powassan, but his organs, including his heart, were full of spirochetes of Lyme. And so that's why they said the child died of Lyme while they were investigating. And so the concern is on this case report of somebody with Lyme carditis is that, the way I see it is that even though you're convinced that the symptoms are just right for Lyme and you know it is and everything's fine, is just remember there's more than one thing in a tick, more than one thing that got transmitted from that mouse or rodent or whatever it was, got into the tick, got into you. And so try not to be too confident that one course of therapy is all you're going to need. In this case, if somebody's thinking about powassan and they're that sick, why not do something for the other tick-borne? And that might have prevented this kid's death, and he never made it to Brown. So what I wanted to do is just go through a few things, dwelling more on co-infections, but the co-infections and Lyme they coexist in everybody's thoughts who's in practice, and they trying to make these tough decisions when you want to be right as often as possible. So thank you very much.
Okay, I'd like to introduce our final speaker tonight, Dr. Krieger.
I'm sure most of you remember the movie Jaws.
She wanted the name
The tagline when they advertised,
Oh, okay.
"Don't go in the water." Okay. After hearing these talks, is don't go in the woods. The problem is that's not going to help because if you don't want Lyme disease, don't live here. Maybe move to an ocean cruise or something because the ticks are all over. And I can tell you, I've never had a tick attached until yesterday morning I found one. I thought, oh, how appropriate, I'm giving this talk tonight. So what do you know? I mean, I'm sure that was it was just to remind me not to forget that I was giving the talk. And I hadn't been outside, if you remember. The weather's been pretty horrible recently. So I think what happened, the only way I can think happened is my dog, which is a pretty furry, fluffy dog, jumps on our bed a lot, and she probably had one in her fur, wasn't attached to her yet. She dropped it on the bed, I got in the bed, and it found me. Who knows? Anyway. I'm sorry?
Less hair.
Yeah, maybe I should shave her down or something, I don't know. So, now let's see if I can get this to work. So, I don't think this is, oh, here we go. Yeah, it's not working, okay.
Down arrow.
Well, it's supposed to say that I'm an infectious disease physician. I work for ID Care, which is a group. And you already heard one of my colleagues speak. Okay. I'm chairman of the Infection Prevention Committee at Chilton Medical Center. And I served on the Governor's Lyme Disease Advisory Council a few years back. I do other things when I'm not doing this. I'm a published novelist. And these are just some of my work. I had to get this shameless plug in before I move on. This one death stare, by the way, is a sort of I call it Stephen King meets Robin Cook, if you like either of those. But you can investigate those on Amazon. Lyme disease got the name, I think Dr. Lassell mentioned, from Lyme, Connecticut, which is where they first identified this infection in children who had arthritis. It didn't make any sense why these kids should have arthritis. It looked like rheumatoid arthritis. It didn't make any sense. And they investigated and said, oh, what do you know? It's a new disease, except it was a new disease that was over 5,000 years old, as you heard in one of the other talks. Probably over 5 million years old or whatever. So Lyme, Connecticut, unfortunately, has the misfortune of being associated with this disease. I understand for a while it was a move afoot for them to try to change the name of it. They didn't like that their town got married to it, but I think they're stuck with it. So not all patients with Lyme disease will have all of the symptoms. So I'm going through a litany of symptoms here. It doesn't mean that everybody's going to get every one of them. There are some people who probably don't have any or have very mild symptoms, don't even know they have it. The other problem with the symptoms of Lyme disease is they can occur in other illnesses. Many of them are very nonspecific, so if you have the symptoms, it doesn't make the diagnosis. And many of the symptoms will go away even without treatment. So it's basically a picture that's as clear as mud. So let's go through them. Lyme disease, we divide it more or less for convenience into early, intermediate, and late. The early disease is when you'd really like to diagnose it and treat it because that's when you're having the least severe symptoms and you can get rid of it most easily. The one that they always talk about is the rash, erythema migrans. It happens about 70 to 80% of infected people. Only 70 to 80% of infected people will not show the rash. I mean, they may have it, but not know they have it. If you get bitten on the back of the head, on the back of the neck, under the arm. I've even seen people who've had it on their belly and they haven't known. They've come in the hospital for something else. We say, well, what's that? Because it's subtle. It doesn't have to be prominent. So a lot of people miss it. It's painless. It doesn't itch. So some people have it. It goes away. They don't even know they've had it. It begins at the site of the tick bite about between 3 and 30 days after the bite, so I'm watching myself to see if I develop one. It gradually expands over several days. This is the classic rash, by the way. You can have variations of this that don't look anything like this description, which makes it even more confusing. And as you already saw in some of the other pictures, and you'll see in some of mine, the center clears, so they call it the ring rash or bullseye rash. Sometimes it's warm, but as I said, it's usually not painful and it usually doesn't itch. And here's just a few of examples. You can see this one is just sort of a red blotch. There's no clear center or anything. And this is actually a fairly common presentation. I've seen this many times. Here's a more classic one, the bullseye in the center, the clearing, and then the outer ring. And the other thing is the rings can be multiple. And if you look closely, you can see these are ring in the center, it is clear. But you can get multiple lesions. Oh, thank you. Finger pointing doesn't work? Okay, so you can see there is some clearing in the center here. It's not as prominent as the last rash, but you get multiple ones. Now these can occur early on or it can occur later on where it can pop up. In fact, it can pop up in places distant from the bite. But again, if it's got this classic characteristic picture, that raises the index of suspicion greatly. And in fact, there's a word we use in medicine called pathognomonic, which just basically means when you have it, that makes the diagnosis. And there are people a lot of times will say that this rash is pathognomonic for Lyme disease. It's one of the few things it is. So what are some of the early symptoms besides the rash? Fatigue, chills, fever, headache, muscle and joint aches, swollen glands. Sounds like a viral illness, doesn't it? I think we've all had these, or many of these, or all of these at one time or another, with many different viruses. So if somebody comes in with these things alone, it doesn't necessarily raise the red flag for Lyme disease, so we do have to be suspicious. Now, if you have one of these things and you either have or have had that characteristic rash, well, then we're golden, we're home free, we've made the diagnosis. Unfortunately, as I said, that's often not the case. People don't come to the doctor because they haven't noticed the rash, then they develop these things, and they come, oh, you have a virus, you have a flu, you have a summer flu, you have a this, you have a that, and the diagnosis isn't made right away. The other thing I should point out is one of the other things we look for when we I think it's on one of my later slides, when we take the history, when somebody comes in with those symptoms, particularly this time of year, you know, we should say, have you been outdoors? Have you had any tick exposure? Unfortunately, we say, have you been in an area where there are ticks carrying Lyme disease? Well, yeah, we live in New Jersey. Of course we have. So if they have a history of tick or potential tick exposure, we need to think very seriously about whether they have Lyme disease. Now, the intermediate symptoms, these can develop in a matter of weeks or even months after the exposure. And they can cross over with the early symptoms. You can have both at the same time. The one that is very telling, again, we talk about pathognomonic, making the diagnosis. If you have Bell's palsy on both sides of the face, there's almost nothing else that causes that. So that's Lyme disease. The problem is we don't see it that often. And the other thing is, I have to be honest, I've never seen it, and I don't know what it would look like. Because Bell's palsy, the diagnosis is made, what happens is you basically get paralysis on one side of the face, and the muscles on the good side get taut and pull on the weak side. So that you've probably seen this a lot of times in people who've had strokes or things, and other things can cause Bell's palsy, and somebody comes in with the crooked face. If both sides are weak, I don't know what's pulling. But I'm sure, all joking aside, if you're examining someone, or if we examine someone and we find this weakness on both sides of the face, that's what they call bilateral Bell's palsy, and that would make the diagnosis of Lyme disease. But more often we see it on one side. And again, if we see somebody with a Bell's palsy, particularly in this time of year, who may have had tick exposure, maybe had some of those other symptoms that we saw earlier, we have to think very seriously about Lyme disease, because that's probably the major cause, other than strokes, the major cause of Bell's palsy in this area. Other things we can see, severe headaches, neck stiffness, which is due to meningitis. Now, meningitis, we've got to be careful using this word because it's very emotionally charged. Meningitis just means an inflammation of the membranes that cover the brain and spinal cord, which is serious business, of course. But when we think about meningitis, like it comes in the news, like a football player on some high school team got it or something like that, that's one very specific type of meningitis, which is extremely serious and most often fatal unless it's treated immediately. This is not what we're talking about here. This is what we call aseptic meningitis. It can make you sick, it needs to be treated, certainly, but it's not going to be rapidly fatal like the way that the one that's in the news. But nonetheless, it can infect those parts of the brain and spinal cord, and we do need to be concerned about it. There can be shooting pains in the limbs and the body that interfere with sleep, heart palpitations. Arrhythmias means abnormal heart rhythm, and heart block means problems with conduction of the electrical signals through the heart, so the heart is not beating in a proper way. There can be dizziness due to changes in the heartbeat and pain that moves from joint to joint. Some of this stuff I know we covered already, and I know we're overlapping a lot in these talks. Then we move on to the late symptoms. Intermittent bouts of arthritis with severe joint pain and swelling. This was what first presented with the kids in Connecticut, which signaled them with the disease. Most often the large joints, especially the knees, are affected, and it can become chronic even after treatment. It's rare, but it can happen, and this is one of the problems. This is one of the complications that can go on. They think there may even be a genetic predisposition that some people will develop this long-term arthritis. And when they develop this, antibiotic therapy is not shown to be any more helpful. They did studies where they checked the joint fluids of these people. They found the infecting organism, the Borrelia, in the joint fluid. They treated them. The Borrelia went away, but the arthritis didn't. So probably what happened is the infection set off a cascade of events, perhaps in the joint, that causes inflammation that no longer needs the infection present to drive it. Other late symptoms, chronic neurologic complaints, months to years after the infection, shooting pains, numbness, or tingling in the hands or feet, problems with concentration, short-term memory. This is a big problem. The neurologic Lyme disease, if it infects the brain, it doesn't cause it. It's not like most brain infections where people get very sick in a short amount of time, or they have a severe disability in a short amount of time. This can be very subtle. They did studies on college students with Lyme disease where they did tests of intellectual function on them, and they seemed to come out fine with those results. The problem is they didn't come out as good as you would expect from college students in top universities. They treated them, and then they scored much higher because they did have an impairment they didn't realize. There can be problems with concentration, short-term memory. People dismiss this as, I'm tired, I'm working too hard, I'm getting old, 101 other things, I'm not sleeping well. And so this can be missed for a long time. A small percentage of patients have symptoms that will last months to years after treatment, like muscle aches, joint pains, arthritis, cognitive thinking, thought disorders, defects, sleep disturbances, fatigue. The cause of the symptoms are not known, and it is possibly, again, it may not be the infection that causes it, it may be an autoimmune response, and I think some of that stuff was referred to in the previous talk, but we have to be careful with that because a lot of people are using this as an excuse to treat people for a very long time, and I'm not talking about 5 or 6 or 8 weeks, I'm talking about months, even years. Some people, unfortunately, are making a lot of money out of that, in my opinion, dishonestly. So let me just talk a little bit about this post-treatment Lyme disease syndrome. It's sometimes called chronic Lyme disease. I don't like that, you might notice. I'd much rather use the new designation post-Lyme disease treatment syndrome, PTLDS. Again, the exact cause is not known. Obviously, the starting cause is Lyme disease, but why it develops, we still don't know. It may be due to damage to the tissues and the immune system that occurred during the infection, or an autoimmune response. In other words, the infection sets off an immune response that doesn't go away even if the infection is gone. And there are other diseases that do that. Campylobacter, which is a common infection of the bowel, causes diarrhea, nausea, vomiting. Chlamydia, which causes sexually transmitted diseases, or strep throat, which I'm sure we've all heard of. It can happen with them. Strep throat, you're probably most familiar with, that can cause rheumatic fever. That's just an immune response, an autoimmune response that the strep sets off. You can cure the strep infection and people go on and still have the rheumatic fever. So there are other infections that can do this. So it hasn't been proven yet, but there's some thought that perhaps Lyme disease could be one of these culprits. Now this is going to be difficult to read because it's a little small, but this is just the different treatments that we use, and they're basically orally. There are basically 3 drugs that we use, and again, they were talked about already: amoxicillin, doxycycline, and ceftin, which is an oral antibiotic. Usually for kids, we give amoxicillin because we can't use doxycycline because that can be toxic to bones and teeth, and we don't give it to pregnant women. So we would give them amoxicillin or ceftin. If they're allergic to penicillin, amoxicillin is a penicillin drug, we give them the doxycycline also. Ceftriaxone is an intravenous antibiotic, which we use for things like neurologic Lyme disease, sometimes severe heart involvement, we'll use it. That's the one who was talking before, intravenous therapy. And again, this is small, I apologize. It's also a little bit of a dirty slide because I copied it. But the treatments, I just wanted to go through some of the recommended regimens. Tick bite, it was already talked about, 200 milligrams of doxycycline after the bite, or, and this was also talked about, observe without antibiotics. I'm proud to say I didn't take doxycycline yesterday. I'm observing myself. There was an interesting study that was done years ago when Lyme disease first broke, where they looked at people in the southern Connecticut area where Lyme disease has first been identified, and they found that these are people who were bitten by ticks which very likely were infected with Lyme disease. About half the people they just followed, watched them, saw if they developed the illness, and about half the people they gave antibiotic therapy just immediately. They found that about 4% of the people who got bitten and didn't get treated came down with Lyme disease in some form or another. So we say, oh, well, none of the people that got treated got Lyme disease. What a great idea. However, about 4% of the people who got treated had adverse reactions to the antibiotics. So it's kind of a case of pick your poison. So my feeling is it's better to watch and see if you come down with it. I mean, it's the type of thing, if you know you were bitten, you're already ahead of the curve, because a lot of people who come in with Lyme disease have no clue they were bitten by a tick. Tick bites are painless. They don't know they were bitten if they didn't find the tick on themselves, if they didn't find the rash, and then the next thing they know they got sick and they don't know why. If somebody who was bitten by a tick a few days or a couple of weeks later gets ill with one of those illnesses, one of those symptomatic illnesses that we talked about, then right away the suspicion is much higher. Just running through these other ones, I don't want to waste a lot of time because this is just that there's different regimens. A lot of the types of Lyme disease, particularly in the earlier stages, are treated orally. Neurologic disease is treated intravenously. Sometimes cardiac disease, it can affect the heart, is treated intravenously. And the persistent arthritis, after we've given 2 courses of antibiotics, if they have arthritis after 1 course, it's possible we missed it the first time, we may give a 2nd course. If it doesn't go away then we treat it like any other type of arthritis with anti-inflammatory medications, pain, physical therapy, that type of thing. The central nervous system infection, brain infection, we want to treat them intravenously because the doxycycline doesn't penetrate the brain very well. There have been studies that have shown that it does work in some people, but I'd rather take the one that I know does work if I have an infection in my brain. And then chronic Lyme disease or post-Lyme disease syndrome, we treat it symptomatically generally. Antibiotics at this juncture are still not proven to be the way to go. Now the diagnosis of Lyme disease is based, again, this is some reviewing, signs and symptoms, which you already talked about, a history of possible exposure to the proper type of tick, and then laboratory tests, which are helpful if they're used correctly and performed by the right methods. There's some labs that are getting rich doing these hocus pocus tests that haven't been proven yet. And then the other problem is people do the proper tests and don't know what to do with them once they get the results back. First of all, if somebody is infected with Lyme disease, they, as with any other infection, they will develop antibodies, chemicals that we produce in the bloodstream to fight that infection. And they're pretty specific for those particular infections. So if somebody has antibodies to Lyme disease, it means that at some point or another they were infected with Lyme disease. The problem is twofold. One, a lot of antibodies will protect you from getting the illness again. For instance, measles. If you had measles once, you don't get it again because you have antibodies for measles circulating in your system for the rest of your life. Lyme disease antibodies don't seem to protect you from getting another infection, and you can get infected again. Problem number two, once you have positive antibodies, you generally have them for the rest of your life. So if you had gotten bitten by a Lyme-infected tick in 1983 and you had your blood tested now, you're still going to test positive for it. So a positive test doesn't prove you're sick with Lyme disease. It proves that at some point you were infected with it, but it doesn't prove that you have it now. Now, if you have a positive test and appropriate symptoms, whole other story. Or then we think much more seriously about that. If, however, the test is negative and we have symptoms, unless they're, like the rash or the double-sided Bell's palsy, usually if the test is negative, it's probably not Lyme disease. We need to look for something else. I'm going to skip through this. This is the Centers for Disease Control just saying what to do about the tests, and this is a little bit technical. We don't have to talk about it. There's two types of antibody tests. IgM means early antibodies. IgG is late antibodies. If you're one of the people who likes to read your lab test, if you have IgM positive, it means you were infected recently, and that's a much more telling result because these don't stay for life. These do. So this test, if you have positive IgG, it just means at some time in your life, whether it was last month or 20 years ago, you were infected. Okay, and so again, another word or two about the post-Lyme disease syndrome. Studies have not shown that patients who receive prolonged courses of antibiotics, and we talked about extraordinarily long courses, which I've seen, unfortunately, there's no proof that these people do better in the long run. In fact, long-term antibiotic treatment for Lyme disease has been associated with serious complications. And I would just like to share one case with you. This was a woman who was previously healthy. She was in her mid-50s, and she was diagnosed with, quote, chronic Lyme disease. I don't know if she ever actually truly had Lyme disease or not, because I saw her after all the shouting was over, so to speak. She was a little bit neurotic, and I think she was very happy that she saw this doctor who told her that she had Lyme disease and needed to be treated. She said, "Oh, wonderful, I have a diagnosis," and she pinned that to her chest like a sheriff's badge and was very happy. So she was started on long-term treatment with intravenous antibiotic therapy by way of a central catheter. Now what that means is they either go in through the arm and run a long tubing in the vein from the arm up into or close to the heart, or they go in under the collarbone and run an intravenous tubing. As you might expect, a piece of plastic tubing running close to the heart does have a risk of infection. Now we use them all the time in the hospital. We use them in outpatients. They're very important places where those types of treatments are used. Cancer, chemotherapy, long-term treatment of infections, whether it's bone infections, heart infections. There are reasons to have these central venous catheters. However, it's also true that you don't use them unless you need them, because they do run a risk. So she was started on at least 3 to 6 months. She may have even been on it longer. I have to admit, I don't remember how long she was on it when I saw her. The point is, it was far longer than we would give any antibiotic. Then she was admitted to the hospital, gravely ill, in a coma. We grew an infection called Pseudomonas aeruginosa from her blood and from her spinal fluid. I talked about meningitis before. This is a deadly meningitis. Okay, it's not contagious. She's not at risk of giving it to her family, friends, or healthcare workers. She's at risk of dying from it very realistically and very quickly. It's a very serious illness. This almost never causes meningitis, by the way. You have to invite it in, and it was invited in by her having a central venous catheter in place for 3, 6 months or longer. Furthermore, the antibiotic ceftriaxone that they were using to treat Lyme disease doesn't treat Pseudomonas, so it makes perfect sense that she'd get an infection with something that's not treated by the antibiotic she was getting. This also underscores the reason we don't give antibiotics when they're not needed, because we can select out bacteria that are harder and harder to treat. This is not easily treated in any situation, but particularly in meningitis. Fortunately for this woman, The admitting physician, who plug happened to be my wife, but that's another story. They called her to see her in the emergency room. They thought she had something else entirely. She says, I think this woman has meningitis, and sure enough she did, and they made this diagnosis, and they called me in and we treated her. And miraculously, and I'm not taking credit for this, I gave her the right antibiotic, but I was just lucky to get her in time, she recovered, although it was a prolonged hospitalization in the intensive care unit, on a respirator for a while, 6 weeks of intravenous antibiotic therapy where we needed the antibiotic, physical therapy for months. Eventually she returned to her former previous life, but I saw her about a year later for an unrelated problem, and her husband said she still wasn't back to herself. And this all came from getting treated for something she probably shouldn't have been treated for in the first place, and even if she did need the treatment, certainly not for as long as she got the treatment. So we got to be very careful about this. You know, if it was a benign thing, you say, sure, what the heck, just give everybody the antibiotic. For the one person it helps. It's worth it. Even if we give it to 10 people, it doesn't help. The problem is there is a very big downside to it. So the good news is that people with this usually do get better, but it may take time. There's a condition, an entity called chronic fatigue syndrome. I forget, do you remember, Dr. Austin, that has a new name for chronic fatigue syndrome? Do you remember, Dr. Cameron? There's a new name for chronic fatigue syndrome. I forget the name for it. I don't want to give old name out. But anyway, it's an illness called chronic fatigue syndrome, or fibromyalgia is another part of that illness. Some people even think that perhaps Lyme disease can set that off. And again, nobody's quite sure what causes that or quite sure how to treat that. So Lyme disease may just be one of the many causes of that illness, and that would present very much like this. So thank you. And